My name is Alex Wrobrenovic, and I am the division manager overseeing LACER's Health Benefits and Wellness Division. And welcome to Open Enrollment and the meeting on the Anthem Blue Cross PPO and HMO plan offering. We have wonderful staff from Anthem that's going to go over some of the wonderful details that the plans offer. So as you know, this is LACER's open enrollment for plan year 2022. The changes that you make during this period will take effect January 1st, 2022. Just like in the past, this open enrollment period will be held October 15th to November 15th. That's the time where you can enroll in a plan. If you're not already enrolled in a plan, you can add a dependent or you can change plans. If you don't do this during open enrollment, the only other time you can do such changes is when you have a qualifying event, such as if you move to a new location and your current plan doesn't serve that area, or maybe there's an addition to your family, a new addition. So it's really important that if you are thinking of making a change, please submit your documents, your health enrollment forms before November 15th. Also, I just want to make everybody aware that this past open enrollment was an unusual one. LACER's was given the wonderful opportunity, the wonderful challenging opportunity to retire a huge number of members because the city was offering the retirement incentive program. And basically that tripled our workload, and we did get some additional staff, but not triple the amount. So we kind of redid our open enrollment schedule. It was a little bit different. So instead of it ending on November 15th, it actually ended at the end of March of this year. So it was extended. But because staff had so much on their plates, we also allowed staff a 3-month window to process any open enrollment requests. So, you know, if you did participate in this last open enrollment period, maybe you put in your request in, I don't know, March, and then it would have been processed anytime, you know, between April, May, or June. So knowing that, we had a stipulation that if you made a change during this past open enrollment period, that if it was effective February 1st or thereafter, then you would not be able to make a change to that change during this open enrollment, because it's really important with the health plans that you're enrolled in the plan for at least a year. And so that's, you know, when the health plans are developing the premium rates and everything, that's what they depend on. So part of the agreement with the carriers was that we would make sure people stayed in the plan at least a year. So again, if you made a change during last year's open enrollment, or this, I should say this past open enrollment, then you cannot change that change during this open enrollment period. Now, if you changed dental plans last year and you want to change your medical plan this time, that's fine. That's fine. Not a problem. And again, only if it took effect February 1st or thereafter are you not able to change the change that you made the past open enrollment. Hopefully that's not too confusing. I'm a little confused, but I think that's just me. Anyways, okay, so moving on. Just real quick, you know, we had a really great renewal again. Actually, our overall premium costs are going down by 1.3%. It's $152 million estimated for all of our plans, for all of our enrolled members for next year. And we have about 24,000 covered lives. So, you know, we're providing health benefits to a lot of people, and to actually see reductions is what I think miraculous. And so we're really thrilled at the performance that we've been doing. And a lot of that is because of you guys. You know, I think it's so important that everybody be connected with their provider, that they're getting the proper screenings. If you're not feeling well, get it checked out, because actually you would think using your plan a lot would maybe increase costs. But if you're doing it to prevent illness, to manage illness, and you're not going in for an emergency situation, you're actually saving money in the end, in the long run. So we encourage that. And so thank you all for being such great health plan participants. Anyways, and the other nice thing is that we're having this reduction with a lot of additions this year. So in terms of benefits and programs, so we're really happy about that. Hopefully you are too. And most importantly, your health subsidy, your medical subsidy. That's what you earn with your years of service, and then that is what is applied to the premium cost of the plan. And so depending on your plan selection, how many people you're covering, and your years of service, you may have no out-of-pocket costs for the premium. You might have a deduction that comes out of your paycheck, but just so you know, for next year, the maximum subsidy is increasing by $93.70 to $1,884.50 a month, which is a great benefit. It's the same for people in the medical premium reimbursement program. And then the dental subsidies, it's staying the same if you're in the PPO plan. But if you're in the dental HMO plan, it's going to be $15.10 a month. Again, that's the maximum. And the dental subsidies can only cover the retiree, not the dependent. Obviously, probably the medical subsidy can cover the retiree. And if there's anything left over after that, you can use it to cover your dependent. And then just some reminders, if you are going to be changing plans, if you are moving, please call us. Let us know where you're going, and we'll let you know whether or not your health plan is covered in that area. We've definitely had people move to a new location, not even that far from where they lived before, and there was a medical facility close by, but for whatever reason, their current health plan didn't cover the zip code they were moving to. And so the only plan available was much more expensive, and they were really upset about it. There's only so much we can do, but definitely being informed is really important. So if you are planning on moving at any time, just give us a call, see what your options are, because healthcare, can impact your budget. If you're on medication and you're going to be changing plans, see if you can get an additional fill before the end of the year. That way, in case there's any weird hiccups, there shouldn't be, but in case there is, at least you have the medication on hand. If you're in the middle of treatment, just let your current doctor and your new carrier know so they can work on coordinating the transition to the new plan. And then really important is your doctor. A lot of people know that their doctor will accept the new plan that they're thinking of moving to. However, they may not be accepting new patients. So even if you're, let's say, in United Healthcare and you want to change to SCAN, and you know that your doctor accepts SCAN, well, they might not be accepting new patients for SCAN. So just make sure that if you really want to keep your doctor, that for sure that they can take you with the new plan. And then just another reminder that any changes to your premium cost will be reflected in your December paycheck, the one that you get at the very end of December. Typically with insurance, you pay the month before the month that it takes effect. So you pay in December for January coverage. So really that's, most of what I have in terms of reminders. We do have some other open enrollment meetings today. Of course, we have the Anthem Hmo and PPO. On Thursday, the United Healthcare Medicare Advantage Plan, SCAN Medicare Advantage Plan on Tuesday, November 2nd. And then next Thursday on the 4th, we have a combination of Delta Dental and Anthem Blueview Vision. And then for anybody that just wants more information about the Anthem Medicare Preferred PPO, the new plan that we're offering, that's replacing the Medicare Supplement Plan. We have got a few more meetings coming up on Fridays, on the 29th, the 5th, and the 12th. So if you want to just pop in and get more information on that, feel free. And one last pitch for our open enrollment page on the website. Everything you need to know is there. You've got the health benefits guide, the overview. You can access those there. You can log into these meetings from there. There's all kinds of information, all kinds of great resources from our carriers, and in addition to what you see in the presentations, just flyers and brochures about their different programs and offerings. And if you want to set up a time to talk to a carrier, or maybe a specific question you want to ask Lacers about, you can sign up to do that on that page as well. So you just go to lacers.org, and then you'll notice there will be like a panel, and then open enrollment is on that panel. You can click on that. Or if you just go straight to the retiree page and look under health benefits, then you'll see the open enrollment link as well.
Good morning, everyone. Thank you, Alex. I'm the Lacers Well Program Manager. I'm responsible for the operations and the program planning. We also have Crystal here. She's responsible for the Champion Volunteer Program, as well as the Lacers Well event planning. We have Betty Smith. She's assisting us with welcoming newly retired members to the Lacers Well program. Crystal, she'll be sharing more about the Champion program later on in the presentation. If you didn't know, our Lacers Well program seeks to enhance retiree quality of life by providing resources and activities to promote better health outcomes and improve overall wellness. The program was created in collaboration with health plan carriers such as Anthem to control healthcare costs, resulting in savings that can be invested in support programs such as transportation, meal delivery, home care, and other valuable resources for retirees. The program promotes a purposeful living campaign based on these 5 elements of well-being: purpose, physical health, financial wellness, social engagement, and community involvement. Lacers Well, we provide so many opportunities for retirees to engage virtually around those 5 elements of well-being. This year in January, we launched a health assessment purpose survey for retirees to evaluate how they're doing in various areas such as pain, movement, and functionality. The participants also answered questions in an effort to discover their interests that support purposeful living. During the year, we also invited expert clinicians, Dr. Doris, Dr. Musai, and Dr. Pryor, to give presentations on issues such as mental health and COVID-19 updates. We also had Elijah here that you just heard from Mom's Computer. He conducts a monthly tech class for retirees to learn tips on using their computers, smartphones, tablets, and the internet. And those are really popular. So we'd love to have you if you haven't engaged with our tech classes. Come on over. Our financial workshops, they also did not disappoint. We had an overwhelming response to our financial mastery and retirement and scam series, as well as our estate planning workshops. We had almost 300 retirees in attendance. If you missed any of those workshops, don't fret. You can find the recorded sessions out on our Lacers YouTube page. So right now I'm going to give it over to Crystal. Crystal, do you have access? I know you were having problems with your internet.
Well, yeah, the internet is still connected right now. Thank you, Stephanie.
Okay.
Y'all was having some technical difficulties. And as she stated, my name is Crystal Baldwin. I've got the opportunity to work with and meet some of you that are on here. And the Lacers Champion program actually recruit retired members to assist us and work directly with the wellness team to plan, coordinate, and to promote health and well-being of our other retired members. So champions usually have a special skill, a hobby, special knowledge, or an activity that they want to share and promote with other members. And this is either done virtually or in person. So as you can see from this particular slide, we have started back up with some in-person activities. Our outdoor, which is El Carrizo Park Walk with Irene. And in Sylmar area, we have a walk in Van Nuys, the Sherman Oaks Park, a walk with Debbie, the Green Trail Walk, Palm Park with Terry and Whittier, the South Coast Botanical Gardens Walk with Nancy, Cabrillo Beach Walk, which will be coming up here in November. So you can go to the website to get more information if you want to join Nancy in that particular tour. We also have golfing, golfing with Jimmy and Londale, and hiking with Ben. We also have champions who have virtual activities, cooking with Carmen, which is done via Zoom, And we have our virtual book clubs with Janet, Bernadette, and Jeanette. And we have a hula class with Beverly and our movie review club. Okay, so those are some activities that we currently have in operation right now. And so as you decide to join the champion team, you can volunteer to assist us with special projects, either in person or virtually. We have the volunteer phone bank that's still up and running. We've had champions that volunteer to assist with calling members during the pandemic. And we also have the Aging Mastery Program that I facilitate, that you can assist us with that as well. So the Champions is the backbones of the wellness program. And we look for more people to join us. I actually got contacted by a member who wants to start a bike riding club. Okay, so if you have a skill, hobby, something that you want to do, something that you want to share, please go online where it says here at the bottom on this slide, it says become a Lacers Well champion. Fill out the form online and we will get the email and I will contact you directly. Okay, back over to you, Stephanie.
Thanks so much, Crystal. And for those that are located outside of the Southern California area, and you live in another state or area, we'd love for you to join us for those virtual activities. Also, you may be in an area that other Lacers members are located, and you can start up a club together. Not to mention that you don't have to be a Lacers member to join in on the activities. You can invite your neighbor or your friend to join you in on the activity. So we have something for everyone. So check out the website, or you can reach us, either myself, Stephanie, my number is listed here, and Crystal's phone number is listed here as well. Or you can call the general number and request either Stephanie or Crystal. And we can definitely get you started and hooked up and linked up with another Lacers member. You can also email us, lacerswell@lacers.org. We also have monthly emails that are communicated out to you. So check your emails from us. They come out either both the last week of the month and the first week of the month. If you're not getting those emails from us, check your spam folder or contact Lacers to make sure that we have your most current and accurate email on file with us. We're not in person at the time, but you can visit our YouTube page and subscribe to our YouTube page to get notifications of new videos there. We have lots of videos out there on various topics on financial management during your retirement. We have the estate planning videos out there, and we recently put out there our fitness classes that we had. We recorded those and put those videos out there. So be sure to visit our website, our events page, our calendar. You can also subscribe to our Facebook page as well. So join us out there on Facebook if you have a social media account with Facebook. So with that, I'm going to now introduce our Anthem speaker for the day, Raymond. Raymond is with Anthem, and he's just a great partner. The whole team, Tammy, the whole Anthem team has been great partners with us, and we really appreciate all that they do for us to provide you with the best plans possible, and the valuable support programs that he'll go over today as well. So now I'll give it over to Raymond.
Wonderful, perfect. Well, good morning, everyone. Happy Tuesday, or as we call it, Happy Taco Tuesday. Welcome, of course, to your Lacers 2022 Open Enrollment session. My name is Raymond. I am one of your Anthem account representatives. So for today, I will be talking. Sorry, it looks like I keep getting muted. So I'll be talking about what's new for 2022. Important things to remember before choosing a plan. Just a little information about your health plan details, your wellness programs, and the tools and resources that are available to you. First, before I go into detail about my presentation, I just wanted to let everyone know that We do have the open enrollment for the Medicare Preferred PPO, the Medicare Advantage Plan, this coming Friday. I know there were some questions in the chat regarding the Part A, Part B plan. If you guys have Part A, Part B. So we do have the upcoming open enrollment session this coming Friday. For today's call, we will be talking about the Anthem PPO and the Anthem HMO plan, and for members that have a Part B plan only as well. So just wanted to let everybody know. But we will be putting in the chat the first impression phone number if you have Part A and Part B, and if you have any questions regarding the Medicare Advantage, also known as the Anthem Medicare Preferred PPO plan, that will be offered for next year. Thank you. So why choose Anthem? We have 76 years of support and expertise experience. We have about 500,000 plus doctors in network across the United States. We have about 4,000 plus in-network hospitals. And we also have tons of programs and resources available to all of our Anthem members. So what's new this year? So the only benefit that will be changing for the PPO and the HMO plan is the Live Health Online virtual visit. So this is the virtual visit through the Anthem.com or through the Anthem Sydney Health mobile app. So if you wanted to do a virtual visit, you can talk to your family practice doctors or to a therapist or to a psychiatrist. So that is moving to a $0 copay. So if you don't want to go physically to your doctor's office, we do have that Live Health Online available to you, and that will be moving to a $0 copay for next year. So that is the only change when it comes to benefits. So always important to remember the following things when choosing a plan. One, I always say consider your personal situation, right? Are you going to be seeing the doctor more often next year? Are you going to be having a major procedure? Are you taking more prescription drugs or medications, right? So those are the important things to consider before choosing a plan. At the same time, also important to compare the costs. So double check your monthly payments, your deductible, your co-insurance, your copay, your out-of-pocket limits. And finally, always important to check to see if your doctors are in network with Anthem. So let's just talk about your Anthem Blue Cross PPO and the Anthem Blue Cross HMO plan, starting with the Anthem Blue Cross PPO. So the eligible members are the retired members, dependents, and survivors under age 65. This is also for the retired members, dependents, and survivors age 65 or older with Medicare Part B only, and also if you're living outside of the United States and its territories. So what is the beauty of the Anthem Blue Cross PPO plan? One, you don't have an assigned primary care doctor, so you have that flexibility to go to any in-network PPO doctor with Anthem. You're not stuck to one doctor only, so you have that flexibility. Second, you don't need a referral for the most part to see a specialist. You can just contact the specialist, schedule an appointment, no referrals needed. You also have the ability to go to an in and out of network provider, but we highly suggest to stay within the in-network so that you can take advantage of the savings, and it also means less out-of-pocket for you. We also have the Anthem Blue Cross HMO being offered. Again, the eligible members are the retired members, dependents, and survivors under age 65. Also, the retired members, dependents, and survivors age 65 or older with Medicare Part B only. So what is things to consider when it comes to the Blue Cross HMO plan? One, you must choose a primary care physician for yourself and your enrolled dependents. That means you need to have an assigned one. You can't just go to any doctors anytime you want. You have to see the doctors within your assigned medical group. You also need a referral to see a specialist. You don't have that flexibility of just going to any other specialist. In an HMO plan, the most important thing is that all services will require an approval and a referral to see a specialist. So if you're enrolled to a specific primary care physician within a medical group, you can only see those doctors within that medical group. So that is the main difference between an Anthem Blue Cross HMO plan compared to the Anthem Blue Cross PPO plan. So you have that flexibility in a PPO plan, but when it comes to a PPO plan, you have that deductible and you have that co-insurance. So it's not, you can't really predict the cost, specifically if you're having procedures done, if you're going to be inpatient or not, compared to an HMO plan where it's more of a predictable cost. Typically, you'll just have co-pays. So just something to think about and something to remember when choosing a PPO versus an HMO plan. We also have the Live Health Online that is available to all of our Lasers members that are enrolled in an Anthem plan. So what is the Live Health Online? I mentioned earlier, it is moving to a $0 copay. So whether you're at home, at work, on the go, or even on vacation, you can have a video visit with a doctor or therapist using your smartphone, a tablet, or even a computer with a webcam. With Live Health Online, you'll have access to a 24/7 access to doctors in about 10 minutes or less. The doctors can also prescribe and send the prescription over to your closest pharmacy. So that's always a plus. So if you don't want to see the doctor in person, you can always take advantage of the Live Health Online. You can also see a licensed therapist, and you can also see a psychiatrist online. So this is a very handy feature that is available to each and every one of you. And again, it's a $0 copay starting next year, 1/1/2022. So these are just tips and tools to save time and money, of course. One, if you really have an emergency, always go straight to the emergency room or call 911. Otherwise, always consider using an urgent care center, a retail clinic, or walk-in doctor's office. Typically, if you use an urgent care center or retail clinic, it's a lower out-of-pocket cost for you instead of going straight to the emergency room. I mentioned earlier, very important, always see a doctor within your network because it's less out-of-pocket for you. Now, for someone that is in a PPO plan, if you go to an out-of-network doctor, there's going to be more out-of-pocket for you. So always stay within the network. For any major procedures, services, always have the provider contact Anthem for authorization to avoid unnecessary charges. I'll be talking in detail later on about the Find Care tool and the Sydney Health app. But in the Find Care tool, we do have a feature where you can look at some of the typical costs for some of the typical procedures, together with some quality reviews for some of our providers in there. And we also have the special discount offers available in our Anthem portal. So if you need to sign up for a gym membership, you want to buy some vitamins, some eyeglasses. So we do have those discounts codes that are available for you in our Anthem.com portal or Sydney Health app. Let me just talk about your Lasers wellness programs that are available to you. So one, 24/7 nurse line. So the 24/7 nurse line is available around the clock. The line is actually staffed by registered nurses to talk to you about your general health issues. If you're feeling sick, if you have any questions, if you should go to the urgent care, emergency room, or wait for a doctor's appointment based on your symptoms and diagnosis, the nurse line can actually help provide you some directions, guidance, or next steps. So if you have any questions, utilize the 24/7 nurse line. It's available for you 24/7. We also have the behavioral health resource available to you. If you're feeling stressed, anxious, or depressed, you can find support with your behavioral health resource. This includes licensed mental health professionals who are available 24/7 for counseling. Just make sure to contact the Anthem customer service team if you have any questions, if you want additional information, and we'll be able to provide you some additional guidance. I'm not sure if you guys remember the Conditional Care program. I know we did some mailings a few months ago to all of our LACERS members. So if you're living with asthma, diabetes, heart disease, or other conditions, our Conditional Care nurse coaches can help you coordinate your health care and actually follow your doctor's care plan. We also have dietitians, health educators, and pharmacies that is available to you as a resource if you have any questions and or concerns. So if you have one of these conditions, please contact our Conditional Care team or contact the Anthem customer service team, and we'll be able to assist you in connecting you with our Conditional Care team nurses. We also have the Diabetes Prevention Program through LARC. So are you guys aware that 88 million Americans are living with pre-diabetes, but only 84% aren't aware that they have it because pre-diabetes doesn't cause symptoms, but it does increase the risk of developing type 2 heat stroke or heat disease as well. So this is why it's important for that you have this program available to you for all of our Anthem members. So this diabetes prevention program through LARC, it's a 16-week weight loss program that can help you lose weight, eat healthier, increase activity, sleep better, and manage stress. We also have the 24/7 coaching support that includes a customized program based on your lifestyle, convenient access to a coach through the LARC mobile app. You'll have personalized feedback to our daily check-ins. We also have tons of educational information on pre-diabetes and preventing type 2 diabetes. And the best part, you can get a free wireless smart scale when you enroll. We also have the My Health Advantage program. So our My Health Advantage program will help you, Anthem LACERS members, make most of your health plan with a personalized reminders about routine screenings, tests, programs, and prescriptions. It also provides suggestions for how you can improve your health and avoid serious health problems. The program can also help you find ways to save money on health-related expenses. So if you do get this in the mail, please don't throw it in the trash. Take a look at it, read it. It contains a lot of great information. Again, there's some money-saving tips in there. So don't throw it in the trash. Take a look at it, read it. Tons of information in there. Now we do have the Silver Sneaker program. So let me introduce to you one of our partners, David on the line, who'll be talking about the Silver Sneakers program.
Thank you so much. And Silver Sneakers is an awesome program, and many of you know it. It's not a pair of shoes, but it's actually a really amazing way of life. And we're a lot more than a gym membership. And that's why I'm here, because that's many of you know us as a free gym membership, and some of you aren't ready to go to the gym yet. But we do have so many other options other than going to the gym. We have an exclusive member portal, silversneakers.com. There's brain health, nutrition, and new content ready for you. So when you do go on there, we have over 200 different videos of on-demand programs. So that's for cardiovascular health, mindfulness meditation, an 8-week series on how to learn Tai Chi, how to learn yoga. You can do this all on your own time and all from your own home. So if you do want to go into a fitness center, you can go some days, or you can stay home the other days, or you can just stay home and work out from home. Now, if you want to stay home and also be interactive and have some sort of social connection, but not have to be in a group class, maybe you're not ready for group classes quite yet, we have Silver Sneakers live classes. That's over 80 live classes just on Zoom. And I know you guys all use Zoom because you're using it right now, but this way you can interact with our instructors. We have national instructors with over 20 years of experience, and our members love them. You can chat with them, they'll chat back to you. You can chat with our other members. So that way you can do things like Tai Chi, yoga, circuit classes, brain health, Spanish classes on Mondays, Wednesdays, and Fridays, and do them all online, interactive, from the comfort of your own home. We also have our Silver Sneakers Go app. Our Silver Sneakers Go app has everything that you need to get your Silver Sneakers ID. You can keep your Silver Sneakers ID on there. You can do all the workouts there as well. Now, of course, you can go to the gym too. We have nationwide fitness locations at silversneakers.com. You can go there. You get your member ID just by giving a few little pieces of information. Then you can get access to over 15,000 gyms nationwide. You can belong to as many gyms as you want at the same time. Yes, you can belong to more than one gym. Maybe you like the YMCA for the pool, or maybe you like LA Fitness because they've got good group classes. You can belong to all of them at the same time. And you could also belong to gyms out of state. Now, if you like, maybe you like to do group fitness classes, but you do not want to be in classes with 20-year-olds doing flip-flops and cartwheels. We have Silver Sneakers classes. These are special classes for older adults. They do range from beginner to advanced. And the nice thing about it is the instructors are specially trained to work with older adults to make sure that they're social. People come early, they stay late, they hang out. You can make social connections. You can make friends there. It's nice to get out. COVID has really kept us inside. Now, many people, if you're feeling safe, you want to get out, it's time to socialize. Next slide, please. So here's something that I'm sure maybe not too many of the people on the call know, but with Silver Sneakers, and because you're on an Anthem plan, you get rewards for engagement. So check this out. All you have to do is go to silversneakers.tuitionrewards.com. I'll write it in the chat, but it's silversneakers.tuitionrewards.com. And you have to be a Silver Sneakers member, so make sure you're on a Silver Sneakers plan. Then just by registering, you get 1,000 points. Then do 7 workouts, whether you go into one of our locations on silversneakers.com, or you go and do one of our live online workouts. So, and a mixture of the two. All you need is 7 workouts in a month. You get 250 more points. Now, each point equals $1 towards free college tuition for over 400 different private colleges and universities nationwide. Yeah, so all you have to do is be on Medicare and do college tuition, and you can and work out, get healthy, and you can get free college tuition for someone in your extended family. So that's something that, you know, Silver Sneakers has that none of the other fitness programs on the other health plans, or excuse me, none of the other fitness programs have. So that's something that's very exclusive to Silver Sneakers, and it's really, really incredibly amazing. So all of you Silver Sneakers members out there, make sure you sign up for tuition rewards and start working out. And that's all I've got. Oh, wait, one more slide, sorry. If you have any questions, our customer service line is open from 5 a.m. to 5 p.m. Monday through Friday. And that's 888-423-4632. Follow us on Facebook. We have Facebook Live. We have 2 live Facebook Live workouts every single week. And we have over 1 million followers where you can watch videos and share them with your friends. And of course, www.silversneakers.com. And that's all I've got.
Thank you so much, David. Really appreciate it. Wonderful program. Absolutely. Especially as Stephanie mentioned, if you have some grandkids in there for that tuition, that'll be awesome. So as I mentioned earlier, we do have the special offers available in our portal. So just visit the anthem.com or the Sydney Health app. Choose discounts. You can save some money on glasses, weight loss programs, gym memberships, and vitamins as well. And now let me just go ahead and discuss some of the tools and resources that are available to you. One is the Sydney mobile app, available to all of our Anthem members, of course. It's kind of like having your health insurance in your pocket. You know, it keeps all of your healthcare information in one convenient place. It is available on the app and Android store. Some of the features include access to your digital ID cards, access your medical and pharmacy information, ability to view your clinical programs along with the well-being tools and resources available to you, and access your health care providers in one location through the MyCare team. So really a convenient app. It's like I mentioned earlier, it's like having your health insurance in your pocket. All of the information are all in there. We also have the My Family Health Record. So this is an excellent feature available in the Sydney and member portal. My Family Health Record lets you track, store, and share your health history and records with doctors and hospitals. That way, you'll be able to easily access previous test results and records. So really very handy resource available to you within the member portal or the Sydney app. We also have the Find Care tool. Our Find Care tool will help you find quality providers and care by using Anthem.com or Sydney Health. The tool searches across doctors, facilities, specialty care providers, hospitals, urgent care, and more. We also have the Care Cost Finder that I mentioned earlier. And one of the features of the Find Care tool is the Care and Cost Finder. So it compares provider and facility costs for at least about 400 of the most common procedures. They're also available to rate providers and review ratings from other members as well. And by next year in 2022, around mid-2022, we will be expanding that, the most common procedures of about 400 procedures to a lot more for next year as we comply with the federal health law. So just wanted to mention that. One of the things that I wanted to mention, as we're still in the pandemic, of course, with COVID-19, we do have some tools available in the portal and on the Sydney app as well. One of them is the Psych Hub, which offers a range of resources to help you and your family deal with the pandemic-related stress, such as social isolation and other mental health issues. We do have the Sydney Care available for symptom assessment, which follows the CDC guidelines. We also have the Find a COVID-19 testing location or find a COVID-19 vaccine location near you by going to anthem.com/coronavirus. And of course, if you have any questions, always stay connected, contact your Anthem customer service team. We also have our Facebook group, Anthem Blue Cross CA, together with our Twitter, Anthem Blue Cross. If you have any questions, feel free to contact us anytime. And thank you so much for having me today. And looks like we can go over some of your questions.
My question has to do with the differences between us B people and the A and B people. Has any consideration been given to help us in some way with our CMS pays, which for some of us are quite expensive? That would help equalize in some way the differences between those of us that were not granted in when the city went to Medicare. And it would certainly help to equalize the differences now because the AB people are getting so much. And my second question is this issue being discussed at the board? How can we get involved?
So thank you, Roberta, for that question. I believe what you're referring to is that when you do not have Medicare Part A, well, first of all of our retired members, when they turn 65, they need to enroll in Medicare Part B, and that has to be paid out of pocket. And then depending on your income level, you may pay more than other people. And so if you have Medicare Part B, you pay and that's it. If you have Medicare Parts A and B, then because Medicare Part A covers hospitalization, it brings down the cost of the medical insurance plan significantly. And so those that have A and B actually get the standard premium for Medicare Part B reimbursed to them. And right now that's $148.50. So yeah, it's definitely a concern that we have discussed, and actually I have a call later today actually with the city attorney to discuss that situation. And I kind of have an idea where we might have an opening to maybe help alleviate some of the financial pressure brought on by the Part B premium for those that do not have Part A. I don't know if it will fly, but I'm trying, and so it's definitely something that we're all aware of. And, it's one of those, it's just such a weird situation. I mean, it really makes us feel really awkward because we're not the ones that set the rules, right? LACERS administers the benefits that the city and the unions negotiated. We don't get to just change them. And so, we're in the awkward position of having to explain to people this unpleasant news, or, this sense of inequity. And so, but just know we do what we can, and we are doing our best, and that's always been on our mind and in discussion. So fingers crossed, maybe today I'll have some luck with my new bright idea, but I don't know.
Okay, great. Our next up is Gwen Butterfield. Gwen, I'll ask you to unmute, and then we have Muhammad.
Okay, here I go. I've unmuted. I have
Great.
two separate questions, one on the Anthem Blue Cross HMO and one on the Anthem Blue Cross PPO for underage 65. On the we're currently in SCAN. My husband's in SCAN and I'm in the Anthem HMO. And we're seriously looking at, during open enrollment, changing to, since I'll be 65 in March of next year, to the Anthem Medicare Advantage PP Preferred or PPO, which comes with, at least for the first few months of the year, the Anthem PPO for me, being during the time I'm under 65. My question is this: I understand it has a $750 deductible. How is that tracked, and what happens if I end up putting out more than a $750 because I don't receive a letter from Anthem in a timely manner stating that I've met my deductible? That's my first question. I'll wait for an answer before I'll ask my second question. Is there?
Yeah, we're
So
waiting.
when you have a deductible, what's going to happen is most of the time your provider will either have a card on file or they will wait until they submit the claim to Anthem to process. And Anthem keeps all of that information. So when we process the claim, we're going to see where you are at your deductible. And then we'll notify the provider. It's called a provider explanation of benefits. And so they'll see how much of the deductible you have left. And not only that, but you also, like the one thing that Raymond had mentioned was it's really important to download the Sydney Health app or register online at anthem.com because it keeps a live account.
Okay, my next question is about the Anthem HMO, which I currently have and have had major issues with problems on the out-of-pocket maximum. When I have in years received a letter from Anthem stating I've reached the out-of-pocket maximum, they send a letter many months, usually the following year, after the maximum has been reached, and nowhere in the letter does it state what date. I've been left to my own devices to get refunds back from doctors. The other question I have is I was told, at least for the Anthem Medicare PPO new plan, that there's no limit on physical therapy numbers of appointments. I'm a pain management patient, and so my physical therapy and acupuncture is at the pain management office where the doctor is for that. It's all in one. On the current Anthem HMO, my medical plan is Optum. Optum covers each and every one of the physical therapy appointments with the usual $20 copay. After many hours and hours that were beyond what you could believe, on the phone with patient support with Optum, I was able to get their explanation of benefits, which showed where I could see when I had 0 patient responsibility for the physical therapy when I had exceeded my 500 max for the year. But for this year and the previous year, Anthem shows that they aren't covering these physical therapy appointments. And so the Anthem computation of my out-of-pocket is never correct. I even filed a grievance at an Anthem Blue Cross or California Care, Anthem Lacer's, reps recommendation, did exactly what he said, even got the pain management to send my entire records, which clearly showed when I exceeded the 500, just not even counting other doctors, just from that one office. All of that was sent to Anthem, and they just sent a pat letter denying. I finally, with Optum's help, it's very hard. The providers can't get through to Anthem, can't get through to the Optum line. Anthem isn't allowed to stay on the line with Optum for more than an hour. And they could never get through. They tried several times. That's why they told me to file a grievance, which didn't work. And then I ended up finally getting somebody at patient service with Optum, and with perseverance from the pain management office, who was also an Anthem in-network on your new Medicare plan. They finally got through, and way into the following year issued me a refund of $300 or so from all my overpayments. So how do I handle this? Has just been a nightmare continuing the last 2 years.
Okay, so
Hi, Gwen.
go ahead, Ray.
Hi, Gwen. This is Raymond. Yeah, what I'll do is I'll direct message you my phone number and my email address. I want to reach out to you offline so we can discuss it further, and I can help research the outstanding issue. One with regards to the service, and 2 with regards to the Optum medical group.
Mm-hmm.
So I'll be reaching out to you. I'll direct message you my phone number and my email address.
I appreciate it. Because of this experience, it makes me very concerned about dealing with this $750 deductible on the Anthem PPO that I'll probably be changing to for the first part of next year. It worries me a lot.
Okay, I would like to make sure that everybody understands that with the Anthem Medicare Preferred PPO, we have a special segment on Friday for that. It does not have any deductibles. It does not have any out of pocket. So it has nothing to do with any of that. So if you're switching to the PPO next year, then this will not be happening.
No, and I appreciate that, and I understand that, and I understand that I've been told by one person on the previous call that with my birthday, March 27th, turning 65, that my Medicare plan would start March 1st, and another person on the same call said April 1st. So I'd also like that to be clarified.
Starts on the first month, the first day of the month of your birthday.
Okay, because the Lacer's rep had said the following month. So do you know, Alex, do you agree with that or not?
If Tammy says so, then I'll go with her.
Yes. So, okay, your birthday.
I didn't mean to put you on the spot, but I would like to be clear.
Because I'm the Medicare Advantage, I'm the group retiree solution specialist with Anthem. So if your birthday month and you're turning 65 and retired, it is the first day of your birthday month. What happens if your birthday's on the first of the month, then it starts the previous month. So if your birthday, Gwen, was April 1st, actually be able to start in March. So it's kind of messy, but so you're fine. Your benefits will start March 1st, as long as you get everything squared away with CMS and work with Lacers on that.
Right. I understand. I have to submit to Lacers and then sometime in early February.
Yep.
Probably.
You got it.
Yeah, and if there was some
Gwen,
confusion, I apologize for that.
Okay.
I know with our regular plans, when you get enrolled and everything is in place, then it gets processed and takes effect the first of the month following. So there may have been some confusion there, but good enough. Thank you, Tammy. And I just want to also point out, for anybody that's having any kind of issues with their health plan or any kind of questions or concerns about service or charges, we have health plan advocates on staff. So we work directly with the health plan carriers to address these issues and resolve them for you. Sometimes we can't resolve them in your favor, but we can at least get you an answer and help you understand the situation much quicker than you can do on your own. So please, 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 if you have any kind of concerns about the care that you're receiving, about charges that you're getting, just call Lacers and ask to speak to a health advocate, and we are here to help you.
I'm actually I'm with my father. Mohammed's right here. A couple questions, and one was where he lives. He's on the very tip of LA County, and every time he gets referred to like doctor stuff, it ends up being like somewhere like in LA downtown or something like that. We want to see if we can get him on Orange County, even though Diamond Bar is technically not in Orange County. It actually is far easier to get, medical help and expertise and all that kind of stuff, in this area, rather than having to drive like an hour and a half or something.
Hi, Mohammed. This is Raymond. So currently enrolled in an HMO plan. Is that correct?
Yes, correct. He was looking at moving an HMO with Blue Shield, but correct, yes.
Okay. So for the Blue Cross HMO, what I can do is let me direct message you my information. So I want to be able to contact you directly and provide you the listing of all the other HMO medical groups closest to your residence, so that at least we can move him to a different medical group.
Okay, great. And then do you have one more question, or was that was the region one? You had another question?
Yeah. What is Anthem Blue Cross that work here in Diamond Bar?
Maybe we'll probably need to talk to a consultant afterwards as well. Could we get a call from a consultant to have because I don't want to hold up the meeting because I know that we have a few questions here on some of the plans.
Yeah, absolutely. Yeah, I just direct message you my email address and my phone number, Mohammed.
Okay.
So please feel free to reach out anytime, so we can discuss the benefits and details, provider information, and any other questions you might have.
Do I have to tell United Healthcare that I am thinking to change plan to Blue Cross?
No, Dad. He just has to fill out a form if he does plan on changing over to Blue Cross, right? The packet that you guys sent, he would just basically fill that out, choose his plan, and then that would be taken care of on the back end. Okay.
That is correct. And then we will be providing an ID card, of course, with the Anthem Blue Cross information. Okay, perfect.
Yeah, with the United Health Care, I have been reimbursed for the B, but my wife hasn't been reimbursed for it. Is that correct?
So the Part B reimbursement is only for the retired member. So if your wife was not a Los Angeles City employee, then she would not be eligible for the Part B reimbursement. That is only for the retired member.
Okay, thank you.
Okay, and no problem. And then Raymond will call you with additional questions because I know we have some. So is after the meeting an okay time to call you?
Yes, absolutely. Sounds good.
Okay,
I'll be waiting for your call, Mohammed. Thank you.
Okay, great. Thank you.
Great.
So first of all, I'm similar to Phyllis, but not always. Okay, so I have an Anthem Blue Cross PPO, and so usually it's 80% Medicare and 20% Anthem. So my first question, and I have a few. My first question is there a limit that Medicare will pay for physical therapy? I had once been told like 18 to 20 visits, but that was for my hip. But there may be something coming up about my hand. Is that an Anthem issue, or is that a Blue Cross Medicare issue? I'm just curious how that works. If the doctor recommend this. Yeah.
Correct. So I think so. You said like a hand issue. So that I don't think that will fall under the routine preventative. I'm not aware of any limits with Medicare per se when it comes to routine preventative visits. But if you do need to see different specialists, different doctors for different conditions, non-routine related, you can definitely see different doctors and different specialists. And under the PPO plan, the beauty of it is you do have that flexibility where you can go to any of the in-network doctors to take advantage of the savings.
Wait,
And to your point, you are correct that it is, that 80% coverage with a 20% member co-insurance after you meet your deductible, Medicare Part B deductible, of course.
what did you say? The hand wouldn't be covered? What if it was recommended by an orthopedic doctor?
No, what I meant is that like a hand problem is not part of a routine preventative visit.
No.
It is for medical visits. So if you do need to see an orthopedic doctor because there's you have a hand problem, yes, that is going to be covered, of course.
And the physical
Specialist
therapy too,
visit,
or whatever. Yeah.
that is correct. That is correct. So you do have your Medicare Part B deductible, 80% coverage, and then there's a 20% co-insurance for you. And that includes physical therapy if the orthopedic doctor recommends you to get a physical therapy as well.
All right. Okay. Couple of questions. So first for the Anthem person. So I guess I didn't register because of the hand issue. I'm not using a lot of computers right now, but so there was a comment made I should register for anthem.com. What would be the purpose of that for me?
Oh, we do have the Anthem.com, which is a member portal, or the Anthem Sydney Health app. It's just a great tool to have, especially the mobile app, because all of your information are there, claims information, your member ID card. If you need to look for a doctor, you can also go through the portal or through the Sydney mobile health app. So it's just a great resource and tool to have in your pocket.
But if I
Especially
don't
if you're
do it
going
on
to
my
see
phone, can I do it on the computer? Either one? Or just
Absolutely. That is
Okay.
correct. You can also go to the anthem.com/CA. If you're not registered yet, you can just register and sign up. If you
CA.
are registered already, you can just log in. That is correct.
Okay, and so Alex, I also too wish you good luck in talking to the city attorney, because since I've been retired over 10 years, I am paying a certain amount of money for Medicare and Part D. And I was just looking at the numbers a few minutes ago. And so per month for Medicare and for the drug benefit, I'm paying right now $328.80. So that adds up. And I think before retirement, I would ask a lot of people about this, but you never know exactly until it's you. That's all. And to be honest, and now that if I take out an RMD, which will raise my income, then it will go up accordingly for that IRMA program. So that's just something additional. So there'll be probably an additional charge for the Medicare.
Yeah, I really appreciate you sharing your information and and your situation. There's a few other members that we've heard from during this open enrollment period, and it's definitely a message I've heard regularly in the past. So yeah, fingers crossed. But I'll definitely bring it up with our general manager as well, and just let him know this is something that we need to look into, and he's always open to finding ways to better serve the members. So maybe we can powwow with some higher powered people than me.
Yeah, that's wonderful. I appreciate it. You have a nice smile. And the part of it is, see, we didn't know how to anticipate this.
Yeah.
But that was really the issue. We couldn't have anticipated this amount per month.
Yeah, absolutely. I
That's the
understand.
key. Okay, thank you again.
Sure.
The only question I had was, I'm on the Medicare PPO plan now, and my dependent, who is a 21-year-old, will I have to do anything additional or when they make the switch over to the new PPO plan, or is that just automatic with him as well?
Is my understanding that your dependent will need to be enrolled in the PPO as well?
Yes.
Stephanie? Yeah, no, then I believe that everything rolls over with, it, doesn't it, Stephanie?
It is, and is that the plan that your dependent is under currently, just to confirm, Chris?
Yes,
Yes.
he's under, but he's under that, I'm in that managed PPO plan and he's under like a separate PPO, but it's the same thing. I mean, he's part of the plan.
Yes.
And okay, so don't worry about it.
Yes, he rolls over automatically.
Yeah.
Correct.
Yes.
Okay, great.
Virginia,
All right. Thank you.
and Virginia
Thank you.
confirmed that.
Appreciate it.
Thank you, Bruce. Virginia confirmed that nothing needs to be done for dependents under 65. If if they like that plan, then they can continue.
Okay, great. Thanks.
Yes, I had these questions about the premium for member and dependent over 65 with A and B, Anthem Blue Cross PPO. What is the premium? How much is the premium that I have to pay, or my wife, I both has to pay?
Do we have a health advocate that can assist solely?
Yes, I do.
That's better. That's a question best answered individually. So, sir, if you can give us a number, a call at the 800 line, and we will look through your different situation because we may have to ask you semi-confidential questions, and we don't want to do so here. So okay. It depends on how many years of service you have, your Medicare status, dependent, stuff like that. So, do you have the number? I can give it to you right now if you like. It's 800-779-8328.
Well, this has been a really wonderful meeting, a lot of great information. Thank you so much, Raymond, Tammy, the entire Anthem team for walking through the benefits for our LACERS members. And thank you all LACERS members for investing in taking the time out this morning to learn more about your benefits. So we really appreciate the opportunity to serve you. Thank you for attending, everybody.